Thank you everyone for joining for our webinar today. My name is Aquarius Jackson. I work with the Baylor Scott and White Wellness team. I work as a wellness advisor too on the team. A few things that we like to bring to you all include some of our activities of our wellness coaching as well as our monthly webinars. As a reminder, we do host these webinars once a month at the first Wednesday of every single month in a 30-minute duration. And this month, our webinar topic is going to be over dental/oral health. As usual, we like to bring in a specialist to kind of help out with some of these webinars that can give you some extra information about some of these different topics. And today for our dental health presenter, we're going to have Dr. Yusuf that's going to talk to us a little bit more about dental health. Dr. Yusuf, if you want to talk a little bit about your background, maybe how you got into dental health, and then we can go directly into the presentation.
Hi, good morning, I guess, to everybody here. I wanted to take this opportunity to thank Jaquarius and Baylor System for inviting me to talk today. I am a dental graduate from LSU, Louisiana State University. I've been practicing here in the Dallas area, though, for about 12 and a half years. I graduated from LSU back in 2012 and have been here in Dallas since then. At my practice, we kind of focus on a more comprehensive approach to treating our patients. We like to give them a full medical approach to treating them and their health because the linkage between our dental health and our medical health is so strong. We truly believe that so many of the different things that we have going on in our body, just in a normal medical setting, do affect the conditions of our oral cavity, and we just want to make sure that our patients and all those around us have a better understanding of that as well. So my background, like I said, I went to LSU. I graduated from LSU. I am a Louisiana native, but have been here in Texas for about 12 and a half years. My wife's born in Dallas, so that's kind of a little bit of what brought us back here. But we love it here, and we just take pride in and are super grateful in trying to help as many patients in the area and in this community as much as possible. So today, I think, we've got a little bit of an agenda for this presentation, and it's going to be very easy to understand, very straightforward, and kind of a little bit more on the basic side, just to help us all understand the linkages and the correlation between our overall health and, of course, our dental health. So we're going to talk about a little bit about discussing the do's and don'ts of teeth brushing. And then we're going to learn a little bit about the correlation of our oral health and our body health. We're going to learn the correlation between oral health and body health and how that kind of works together in a positive and negative way. And then we're going to review some product recommendations that are associated with or that are recommended by the American Dental Association. So first, just to start things off, we're going to play a little video for you guys about of a individual brushing their teeth, and then we'll kind of discuss that video and see, what we can kind of take from that video from positives and negatives. So some of the positives and negatives, I think everybody could tell that, for sure one of the positives was that the duration that the individual was brushing for was, a pretty decent amount of time. A lot of people they like to brush for about 15 seconds, even with toothpaste. And that's just not adequate. We recommend, dental professionals will uniformly pretty much recommend between a minute to 2 minutes of time, taking our time to brush those teeth properly. And that's, just at kind of a base minimum. The other thing that we can notice from this video that was a positive as well was the fact that he kind of brushed each area of the mouth individually. So I think we spent enough time, a good amount of time on, let's say we started off on that upper right side, spent some time, brushed in circular motion towards the gum line and kind of focused on that area, then went to the next area, then the next area, then the next area. And then kind of came back and did the entire thing again, the whole cycle again. So that's a very positive thing that we can take from this video as well, because a lot of times when we're brushing super fast or we're not focusing when we're brushing, we just kind of do the whole mouth really quickly. And like I said, about 10-15 seconds, we're done. We spit out our toothpaste and we're out of there. But even if we're spending a little less time, if we have a regimen or a routine that we can follow, for example, let's do each quadrant of the mouth, 1/4 here, 1/4 here, 1/4 here, 1/4 here at a time, so that even if we're just spending about 10-15 seconds on each of those and we finish at a minute, at least we know that we focused on each spot of the mouth and we didn't leave something without it getting properly cleaned, or at least cleaned a little bit. The other thing that I think that was very positive from this video was that you could see that the types of strokes that he was doing. It wasn't a very strong, trying to like break the teeth. It was a nice kind of gentle stroke. And then also you could see that circular motion as well a lot of times. So he was kind of aiming those bristles of the tooth, if we're focusing on the upper teeth, towards that gum line, and just like in a more gentle circular motion, getting those areas underneath the gums, right underneath the gums, clean as well. A lot of times we do kind of brush over that. We don't think about that, or we're going super hard at a 90-degree angle against our teeth. And that can actually be causing a little bit more damage than good. Because if we're not brushing in the proper technique or in the proper way, we could actually be causing recession to our gums or damage to the gums themselves and the teeth. We see lots of patients that in the past they used to use very hard bristle toothbrushes. And those toothbrushes, when used at a 90-degree angle against the teeth, can cause a lot of damage to those teeth, almost to the point where you see a big kind of ditch in the tooth. Almost looks like those old cartoons when you'd watch the lumberjack kind of cutting down the tree, and you see that big V that gets formed because of the cutting down motion. So we got to be very careful about that. So I think the video did a really good job about showing us many of these positive techniques that we can utilize when we brush ourselves as well. Okay, so why is this a big deal? Who cares? Okay, I brush or I don't brush. Like, what's the big deal? It's just my breath or it's just my teeth. Well, it is a huge deal. And that's what we're here to really talk about. And it's not just about brushing your teeth, but it's the fact that our oral health is what truly allows us to eat, speak, smile, show emotions to all of those around us and even to ourselves. Poor oral health can lead to a very low quality of life. This is a proven fact. And if you don't believe that, I really invite you to come to our practice here and just watch us for a day. Patients who come in sometimes with very poor oral health, they tell us themselves. We don't even have to say anything. They'll tell us, Doc, I haven't smiled in 20 years. I mean, how do you think that makes a person feel? Not to mention the bacteria that's in there, the infections that sometimes are in the gums or in the teeth. So many different factors that the emotional well-being of a person is so linked to how we feel about ourselves. And if our teeth are constantly hurting, or we don't even just like don't like the way that our teeth look, it definitely affects our overall health. And then mental health, of course, is at the forefront of so much nowadays. And it does affect how we feel, how we view ourselves, how others view us. Not to mention, with mental health issues come medications, and those medications have lots of negative side effects to our oral condition, as we'll kind of talk about and touch upon uh, in a little bit as well. But those medications, even though they make you mentally feel a little bit better, they may be causing other issues within our oral health, and that it's kind of like a negative cycle. So if we can keep our oral health in as good quality as possible, it just helps set up everything else for the best outcome overall. Okay, so how can we go about making sure our oral health is in as good a condition as possible? So this is kind of what we preach day in, day out. It's all about prevention. So many of us growing up, we may not have visited the dentist that much. I know I didn't as much either. But that's because a lot of times we look at um, our oral health kind of like a um, just an extra, right? So a lot of times we're just like, oh, we're not having any pain, we're not having any problems, I'm eating fine, my teeth aren't hurting, I don't have any much sensitivity, okay, I'm good. Why do I need to go to the doctor? Why do I need to go get my teeth cleaned if nothing's bothering me, nothing's hurting? So much so this has been kind of ingrained in us for such a long time that we have patients or people that we all know that will sometimes kind of semi brag about the fact that, oh, I haven't gone to the dentist in 25 years, as if that's a good thing. Not really truly realizing the fact that, well, you didn't go to the dentist for 25 years, but you have maybe no idea what might be going on underneath the hood, per se, of your gums and of your mouth. Just because something doesn't hurt doesn't always mean that there's nothing going on. So, excuse me. So I think that's a very important factor, is that we have to realize and truly educate ourselves and those around us and our families, friends. Um, and for us as dental professionals, we have to educate our patients as much as possible so that they understand and that we all understand that dental health, oral health is really all about prevention. When we see you in our chair every 6 months minimum, it's really about preventing more and more issues from actually arising. So, part of that regular preventive exam or visit is truly about lowering the risk of getting cavities, number one. Number two, it's also truly, gum disease is such a rampant thing that's around. And we really need to make sure that we're on top of gum disease. Gum disease is probably the number one, not probably, after cavities, is the number one reason that people lose their teeth prematurely. We were given teeth, two sets, the baby teeth and the adult teeth. The baby teeth were meant to come out and be replaced. The adult teeth are not meant to come out. We should be going to our graves with as many, if not all, of our adult teeth. Now, of course, things happen. There's accidents, there's, different things like that. But these teeth, if we are able to take care of them as much as possible, go for our routine visits, all of those types of things, we should be in a position where we may be able to try and keep those teeth for the rest of our lives. This includes going to have an exam and a cleaning at the minimum every 6 months. In that exam, we do x-rays, we do a visual inspection, we clean the teeth, we are scaling and getting underneath the gum surfaces, and polishing also all of those surfaces to make sure that your teeth look and feel as healthy as possible. And then the doctor and the hygienist will typically do a thorough examination of the oral cavity. This includes an oral cancer screening most of the time, if not all of the time, to make sure that we don't see some type of oral cancer that might be coming out, and or a bodily cancer that sometimes will present itself in the mouth first. There are a couple of diseases that are um, very strong and very powerful diseases that actually present themselves in the oral cavity first. And if you can catch an early sign of some type of disease process, then of course it makes your prognosis of surviving that disease or illness much higher. All right, so kind of some of the things that we talked about just now, but during that exam, we're looking for cavities, we're looking for oral cancers, and then we're looking at different things on the teeth, such as stains, wear and tear, some of those, like we talked about earlier, when people are brushing super hard and create divots in the teeth. We're looking for signs of grinding and clenching. We're looking for different things that we can see that are formed by habits that we may be, as a patient, doing on a daily basis, either knowingly or unknowingly. And then following up after the exam, these are crucial appointments that are made so that we can make sure that you can maintain a level of oral health that we'd like for you to maintain. So, depending on what was seen or visualized during that preliminary exam and that initial exam, these could include just, if everything is healthy and looks good, it could just include scheduling the next 6-month exam and cleaning. It could also include sometimes the patient comes into us and they actually need a deeper level of cleaning instead of a basic level of cleaning. So, maybe they need a deeper cleaning. That's something that we would recommend at that first appointment. It's possible that maybe they need fillings for some cavities, possibly a root canal if something is bothering them or hurting or infected, or any, extractions, any type of treatment like that a patient may or may not need at that time is kind of recommended. And then we try to follow up with that treatment plan and get those things done before the next 6-month cleaning. Okay, so body health. Going to the dentist benefits more than our oral health. Your oral health is a reflection of your overall health, and the dentist can detect some health complications early through a routine exam. Now, this is kind of what we already touched upon with the fact that some actual disease processes that show up in the mouth will actually present themselves first in the oral cavity. That's number one. Number two, a lot of routine things that we deal with in our mouth as well can sometimes present in the oral cavity also. So, for example, if we have a lot of inflammation building up within our body, sometimes we can see that within the gums as well. And that should be pretty prevalent within the inflammation that we see in the gums upon our normal examination. This graph is really awesome to show us a lot of the different areas within the mouth and within the oral cavity that we can see other health conditions show up. Now, before we go through each of these, I do want to talk about that line at the bottom. The fact that a history of poor dental health does not always guarantee these above things or chronic conditions such as heart attack, heart disease, stroke, cancer, etc. But it's also extremely important, just as we're talking about maintaining our regular care within the dental field. But it's also very important for us to maintain our regular care within our PCP visits and, making sure that we go and see our primary care doctors and specialists if we need to. Now, just as it doesn't mean that these conditions will be present, and it also does. So another factor that I want to point out is that, for example, gum disease, it puts us more at a risk of stroke, heart attack, or Alzheimer's. It doesn't mean that if you have gum disease, you will definitely have a stroke, heart attack, or Alzheimer's. So that's kind of that disclaimer there. But now let's say that you are a patient that has had a family history of a lot of high blood pressure, right? Or you have a family history of Alzheimer's or heart disease. Now, if you couple that family history with the fact that you have severe gum disease, now that definitely gives you two kind of red flags or two um, risk factors for being at higher level of risk of having a heart attack or having heart disease or getting Alzheimer's. Alzheimer's and a lot of these neurodegenerative diseases that are starting to present themselves more and more in our aging population, they are highly linked to the bacteria that is present in patients that have severe gum disease in the mouth. So again, you know, as with all of these that we're going to talk about, just because you have one of these things does not mean that you will have that health condition, but it just puts you, or that this will cause that health condition, but it just definitely puts you at more of a risk of having these things. Now, when we see, for example, mucosal lesions or red band gingivitis, for example, this definitely puts us on high alert that sometimes there's there's specific lesions that show up in the mouth, specific ulcers that show up in the mouth that are highly linked to HIV and AIDS or different types of oral cancer. And when we see those, a lot of times there, for example, there is a lesion that shows in the mouth called Kaposi's sarcoma. And this is one of the lesions that actually shows up as a first sign in a patient that has initially contracted HIV, right? So this is actually it's almost exclusively before that patient shows any symptoms, feels anything negative in their body, yet the oral lesion might be present. Okay, it doesn't present in all of those patients, but if it does, and a dentist is able to notice that, then it puts that patient just in the driver's seat of being able to manage their health. It puts them at an advantage because they know about what's going on at an earlier stage. Same thing with oral cancer. There's lots of oral cancers that can present, and it puts the patient at a higher level of being able to handle their health. Because when we can get you to the medical professional, to the oncologist, or to the professional that will be in charge of managing that condition, you are just in the driver's seat and being able to take care of yourself in a much more controlled environment, hopefully before things get to be too advanced or complicated, so that we can handle these health conditions much better. So a couple other things that, sometimes we can notice that patients have bone loss around the teeth or jaw, or tooth loss, and maybe they're doing a decent job brushing. This can be linked to some osteoporosis or weakening of the bone in the body in general. We can also notice sometimes, patients that have anemia or a low iron level in their body, their gums present a certain way, their tongue presents a certain way. Oral thrush, which is called candidiasis. This is also, sometimes linked to patients with diabetes or other fungal infections. There's tooth erosion and lesions on the throat. A lot of times we can tell if patients have some type of gastric issues, some type of acid reflux, even patients who may have bulimia or are vomiting a lot for other reasons. You can sometimes notice the negative effects on the teeth. And then again, with the oral cancer, we can look, this part of our oral cancer screening is that we can see lumps around and inside the mouth sometimes, and around even the exterior in the lymph nodes in the throat, in the neck. Plaque itself, which builds up for every single patient, for every person, is linked to a higher prevalence of heart disease and can cause more patients. If you have a high level of plaque in the body, this can cause patients to actually have a higher prevalence of actually dying from a heart attack if they have one. Even there's different levels of bacteria that are in the body or in the oral cavity that have been linked to women having miscarriages. So, again, it doesn't mean that it will happen, but it just puts a patient at a higher risk of having these negative health effects. And that's our main focus, is making sure that patients understand these risks and really educating themselves about that so that they can take better care of their oral cavity, which in turn will help them take better care of their overall health. All right, so how can we make our teeth stronger? So first, again, making sure that we're getting our regular checkups and cleanings. That's the number one thing, because if we don't know what we're doing or what we need to do, then how would we be able to do it? So we go to the professionals, we get their advice, we get their recommendations, and then we maintain a good oral hygiene routine at home. That means brushing, flossing twice a day, or after every meal if possible. And then also maintaining a healthy diet and drinking plenty of water. These are things that are super important to keeping our oral health in a healthy situation. The better the food that we put into our body, it affects us in a positive way. So if we're eating less sugars, less artificial sweeteners, or less artificial substances, for example, that's just going to be better for us. Just as it is better for the rest of our body, it's better for our oral cavity as well. All right, just going through a couple of product recommendations as we get close to wrapping up. We do recommend toothpaste with fluoride. And this is really, fluoride has been shown at low levels to truly, truly help fight and prevent cavities. And that's, really, really something that from an early age is just so important. That's why even water, city water, usually has a small level of fluoride, nothing that's going to cause something negative. And none of those claims really have been super proven, but it's a very low level, and it just helps to really truly fight decay that does form within our mouths. We also do recommend electric toothbrushes because it just puts that circular motion automatically into place so that you're not having to think about some of those things, and it just becomes automated, right? And then again, final product recommendation that I would recommend is an alcohol-free mouthwash if you're using a mouthwash. I'm not a huge proponent of mouthwashes in general, but in general, if we do use it, I would definitely recommend alcohol-free. Alcohol agents in general will dry things out. So think about the hand sanitizer that we use all the time. If you use a lot of hand sanitizer, your hands are going to be pretty dry all the time. You're going to be using a lot of lotion. Alcohol does the same thing inside of the oral cavity. So making sure that we're not using alcohol, because our saliva is one of the things that helps to protect our teeth from getting cavities and all of those negative things. So an alcohol-free mouthwash is something that I would be recommending. Also avoiding hard bristle toothbrushes. Water flosses. So water flosser is not something that as a blanket that I do avoid. What I mean about this is the fact that many patients come to us and say, oh, I don't floss, but I just water floss. Now, water flossing is great for cleaning out the gums, but it does not substitute totally for flossing, because our teeth come together and they touch each other. So if we're just water flossing, we're just passing the water through, and we're not cleaning that surface that the teeth touch. So we want our floss to go through and clean those surfaces as well, and so that we're not just doing one thing and not the most important part. And then do it yourself whitening agents. Sometimes they can have negative effects. Sometimes they can cause erosion of the enamel. That's why we definitely do typically recommend, if you're going to do some type of whitening or bleaching, that you do it through a dental provider. Even if they give it to you to take home, it's still going to be much safer and better for you than just getting something from the store or Amazon. All right, and just wrapping up my portion here. If of course, if anybody were to have any questions, they can definitely visit us in our Prax location. Our website is listed there as well. We would love to educate and inform as many patients as possible This is really, something that we feel super passionate about. We use really high levels of technology. We use 3D intraoral scanning. We use CBCT scanning for our head and neck. We use so that we can see everything that's going on. We take lots of pictures. We take lots of scans. We do a lot of record taking so that we can help to inform our patients as much as possible about what's going on inside of their mouth, and we discuss how that could be negatively affecting their overall health as well. I saw a couple questions pop up on the chat, and I'll try to answer some of those before we get to maybe anyone else as well. If soft brushes are recommended, why are hard or medium brushes still around? What are they used for? That's a great question. So typically, soft brushes are what we recommend. Soft medium brush is also something that I'm okay with recommending. The hard brush is really, a lot of people will use them for cleaning their dentures or for cleaning their night guards and retainers. I definitely personally do not recommend hard brushes. I think it's possibly also still around because a lot of people are just so used to using those from a long time ago because that's what was recommended. But the soft and medium are definitely much more gentle to the teeth and to the gums. And, what we're seeing, over the last 40, 50 years is that those are the ones that are definitely more gentle and better for our oral health. Next question. I heard that you are not supposed to brush right after you have had sweets because the acid can affect your teeth. How long is it recommended to wait? So I'm not sure the acid. I'm assuming maybe someone thought there was some acid in the toothpaste, but I would definitely recommend brushing after sweets, pretty much right away. So the longer anything stays on your teeth, the worse it is. So even with drinks, for example, if you were to sip, if you are somebody who just sips on beverages all day, that's actually worse for you than if you just drank everything, within 10, 15 minutes and then got it clean. Because as we're sipping or snacking all day, that means our teeth are constantly and continuously getting coated with that plaque and bacteria, the biofilm that forms right away. And then it just sits there and starts to erode and eat away at our teeth throughout the day. So we should try to brush, pretty quickly after having sweets or any food, really. So I wouldn't really say that you're recommended to wait much, if at all. Changing out toothbrushes, I would say between 4 to 6 months is a very good, I would say, time period. 3 to 6 months is pretty standard, I would say. The teeth whitening toothpaste. I think what's available over the counter is relatively safe, but I would say I personally try not to go too wild and get these newer name brands that we may or may not know anything about, especially off of like Amazon. There's lots and lots and lots of brands out there now. I would stick to the Crests and Colgates. There's a couple of new brands out there, also Act and Hello. I think all of those that you can find in a regular, normal big box store should be okay. The reason I recommend just sticking to those is that anybody could go and make a toothbrush or a toothpaste and post it, and it could have erosive agents in it. We just don't know. They can sell it, and you could be actually doing a little bit more damage to the teeth. And that's also why we recommend staying away from those. Do it at home, do it yourself whitening agents, because they could have erosive agents in there that are eroding away at your enamel, causing more damage, sensitivity, pain, all of those types of things. So I would try to stay away from those as much as possible. Stick to the bigger brands, and I think you'll be okay. And then what age should we start? So technically, we really recommend kids actually to come to the dentist from age 3 months, believe it or not. For many kids, it's actually, it's just about getting comfortable and used to coming to the office and being as comfortable as possible in that new setting. So a lot of patients, adults especially, they never got into that routine of coming to the dentist. So it just never became part of their like upbringing, their life. So then they carried this anxiety and this fear of going to the dentist from an early age, and it still just stuck with them throughout their lives. And it, it can lead to a lot of negative things. Then we don't go to the dentist for 6 years or 16 years or 60 years. And then we have a whole mouth of cavities or gum disease or, bone disease, different things like that. And it could have all been avoided by just setting up a nice, good routine. Most insurances even will cover visits for children starting from 3 months and up. And I think that was all the questions that I saw on there. I do appreciate everybody for joining in today and for inviting me to be here and speak about something I'm very passionate about. And again, definitely would love to see you at our practice. If you have any questions, concerns, anything at all, that's what we're here for, is to try to help educate the people in our community so that they can take better care of themselves.
Awesome. Thank you so much, Dr. Yusuf, for your time today. We really appreciate it. There are lots of comments in the chat about the great information and how people learn new stuff. I know even for myself, I learned some new stuff today, and I was talking to my team earlier about how I went to the dentist actually like 2 weeks ago, and
Mhm.
even just from the last 2 weeks I went, and just today I learned a ton of stuff that I didn't even know then. So I really appreciate all the information, and I think a lot of things you shared today about the correlation to dental health and our body health, I think is going to help people make a lot more conscious decisions about being a little bit more prominent about taking care of their dental health. So thank you again for all the information that you shared.
No problem at all. Thank you guys for having me.
Outside of that, everyone else that is still on the call with us, as a reminder, we do have that Baylor Scott and White member portal that you guys can access. The member portal is going to be a great resource to look for dental care and some of those providers that are in network for your insurance. So I definitely encourage you to take advantage of that as a resource as you're looking for dental care and scheduling your next 6-month appointment. Outside of that, thank you all once again for joining us. As a reminder, we do these webinars at the top of every Wednesday of each month. So our next webinar will be on November 6th at 11 o'clock, and it will be on diabetes and eye health. So we'll be focusing on how your eye health is a little bit affected when you have diabetes. Another small plug I do want to make is that on October 8th, we'll also have a small webinar as well, just to kind of discuss our diabetes coaching program in lieu a little bit more as well. So if you also want to learn more about that, that'll also be another great opportunity to learn more about what we do as a wellness team as well. Outside of that, thank you all as usual for joining us. As a reminder, these webinars are always going to be recorded and you can access them in the hub. And we have pre-recorded webinars from all throughout the rest of the year. And we'll continue to do so to make sure we have resources for you all to access. Thank you all again. I hope you all guys have a good rest of your day.